I am Stacy Hurt. I am from Pittsburgh, PA. I am a stage 4 colorectal cancer survivor, and I am also the caregiver and mother of my beautiful son, Emmett, who suffers with a rare disease of a chromosome abnormality so rare that it doesn't have a name. He's one of 3 known cases in the world. I work as a patient engagement consultant to tie in my 20 years of healthcare executive to my experience as a patient and a caregiver and fill the gaps between industry knowing their why and why they do what they do to their end user, ultimately the patient and the caregiver. My mission is to stand up and speak for those who cannot stand up and speak for themselves. Ultimately, through my advocacy work, I have met thousands of patients who are too sick to speak up for themselves, under burdens of financial toxicity or disease severity or things like that that are just too ill or afraid or intimidated by the system to talk about how they're affected. So it is my mission, why I'm still alive, is to be here and stand up and speak for them and get them the care that they deserve, no matter where they live, what their background is, what their access situation is. Every patient deserves the same quality of care that I got and why I'm still alive. And so I fight for them. I think that COVID completely exposed these huge gaps in care between people who had access to technology and data and those who didn't. 2020 was the problem. 2021, we talked about the problem. 2022, we really need to do something about the problem. And we need to work together. All the stakeholder groups need to come together. The providers, the payers, the health systems, the patients. We're all in this together to solve this problem. This problem is big, and it needs all of us to come together and identify those gaps and close them. Data is so critical in the patient experience in terms of treatment decisions and life decisions. So I have literally made life or death decisions based on data that I had. Literally planning the next 6 months of my life was dependent on a scan result. So that data is incredibly important to shaping the patient journey and the patient experience. So the more access that we have to the data, the more we know how to use it and how to put it to our advantage to help our care, the better that the overall outcomes and quality of life are going to be. The patient owns the data. We own our data. It is our asset. It is our proprietary information, and we deserve to know where that data goes. And, much like a best friend borrowing your car, it's okay that they borrow your car. You just need to know about it. So that's how we should treat this data, that it is a patient's data. We need to be as transparent at the beginning about where that data is going and how it's being used. And then therefore that builds the trust in the relationship with the care team, which will ultimately lead to better outcomes. If you're a healthcare company, you absolutely need to employ patients in high-level decision-making capacities to help shape the strategy of the company. So I think that Komodo is a trendsetter and a leader in what they're doing by employing a patient advocate on their executive leadership team. Because unless you have sat in that chemotherapy chair and you have had that poison run through your veins, or you have held the hand of a patient who sat in that chemotherapy chair, you have no idea what that experience is like. So you can't talk about a patient experience unless you have experienced it firsthand as a patient or a caregiver or care partner yourself. And so I think that that is critical for patients to have that level of empathy. I think formerly companies have shied away from it or thought that it was some sort of a vulnerability or a weakness. That vulnerability is a company's greatest strength, because that is what will shape and redefine the healthcare system. And that's the kind of bold moves that we need to make change right now.